Thank you, Claire. And I'll now turn the microphone over to my colleague, Stephanie Holm. Stephanie is a pediatrician and occupational environmental medicine board certified physician and the co-director of the Western States Pediatric Environmental Health Specialty Unit. And she's going to talk about respiratory protection in children. Take it away, Stephanie.
Thank you so much for having me to speak. If we can go ahead and start showing my slides. This next slide are just my standard disclaimers. So I received some of my funding from AAP and federal EPA as well as ATSDR. I also work for OEHA, which is the Office of Environmental Health Hazard Assessment in Cal EPA. But my comments are my own and not official stances of any of my various organizations. All right, so why should you all be particularly concerned about children? Well, children often spend more time outdoors relative to adults and also spend more time running around. They're much better about exercising than we are. When they do that, they increase their breathing rate and therefore take in more airborne pollutants. And in particular, even when they're not exercising, children have a higher minute ventilation relative to their size, so higher minute ventilation per kilogram of body weight, which means that they breathe in both a higher volume of air and higher volume of any airborne irritants compared to adults. In addition, there are good data that children who have lower lung function become adolescents who have lower lung function and become adults who have lower lung function. And so for all these reasons, children are really uniquely vulnerable, and protecting them should really be at the forefront of our minds as we think about respiratory protection for the broader general public. Okay, when we're talking about masks or respirators for respiratory protection, such as from air pollution during wildfire smoke events, what we need to think about is protection for the wearer. And so for this application, there's two main things to consider. One is the filtration property of the material itself, and the other is how much can leak in around the edges, how many particles can pass around the edges of the mask or the respirator. Let's first talk about cloth masks for a minute. They've, as you all know, become a particular topic of interest in recent memory. But when we're thinking about cloth masks for protection from particulate pollution, a number of studies have found wildly different filtration properties among different types of fabric and even within categories of fabric. So saying that something is a t-shirt or a sweatshirt or a scarf or a hijab, or that describing that material in that way doesn't really tell you anything about its filtration properties. And that's not surprising, right? We aren't designing our fabrics intending for them to have certain filtration characteristics. Notably, in some studies, some of the fabrics seem to actually pool particles, such that there are higher levels of particles reached inside the fabric than out. And then last, in a study that actually assessed exposure, so both the filtration and the leakage, the decreases in exposure from things like bandanas and even some commercially available cloth masks, the kind of things that Claire was just showing before, sometimes the decrease can be as low as 10%. So it can be quite low and it's highly unpredictable. I mean, for that reason, even though cloth masks are currently recommended to decrease droplet transmission of viruses and clearly have a role there, they should not be relied upon to decrease exposure for particulate pollution. And then a particular kind of mask that we could consider is medical or surgical masks. Again, these are actually not designed specifically for respiratory protection either, as I believe a lot of you know, but rather to keep the surgeon from contaminating a surgical field with droplets. But because they're a product that is at least somewhat regulated, there's a question of whether these could provide some amount of respiratory protection. If you test medical and surgical masks specifically for filtration, so again, just looking at the characteristics of the material, multiple studies have found that this material can filter out something in the range of 60 to 80% of particles, although there's quite a wide range again, because this isn't their intended purpose. However, because surgical masks don't fit tightly to the face, you would expect a substantial amount of leakage around from the edges. And that fits with the data that show that if you're looking at the overall decrease in exposure for people, it's more in the range of 20 to 30%, even though the material itself can filter much better. The only study that's actually tested surgical masks specifically in children was a very small study in the Netherlands. They tested in a sample of 11 children and found reductions in that sample of 66% in the kids' exposure. That was very similar to what they found in adults. And notably, that was with researchers helping the kids secure the mask tightly to their face. So it may well be that they were getting a pretty good seal in that study. This suggests, though, that the protection expected for kids from a surgical or medical mask might be somewhere in the same ballpark as what you would expect for adults, but that similar to adults, the fit to the face is crucially important. Okay, and then let's specifically talk about filtering face piece respirators. There are three big issues to keep in mind as we move to discussing them, particularly respirator use in the general public. So the first is that this necessitates the use of respirators without fit testing, which is of course different than how they're used in an occupational setting. There's really no regulatory body right now who's tasked with making decisions or certifications of respirators for the general public. And then third, just as sort of a note, I'm not going to present data on the filtration characteristics of the material like I did for those last two kinds of face coverings, because by definition, in order to be certified as a filtering face piece respirator, this material must have really good filtration characteristics. Okay, so looking at exposure for non-fit tested people wearing respirators, in the most recent NIOSH paper in this topic, the 95th percentile value was a reduction of 70% or more. So that means that 95% of the people tested had their exposure reduced by 70% or more. I will say there are some products that perform substantially worse than this without fit testing, and some that perform substantially better, including some that would meet the usual criteria for occupational use. That's a 90% reduction or a fit factor of 10, if you're used to thinking about things that way. There are some products that would meet those criteria even without fit testing. So that certainly raises the question of whether in the future we could have products certified for the general public that could have more stringent requirements for how much of a reduction in exposure is required in the absence of fit testing. And these data also suggest that some protection of the public is possible without a respiratory protection program. I think this is really important because, though we historically have found that those are really useful in occupational settings, as a lot of the prior speakers have discussed, I don't know what a program like that could possibly look like for the general public. And so knowing that some protection is still available without that is really important. And then I've noted here at the bottom of the slide that a few studies have shown beneficial health effects for adults who wear an N95 respirator in the presence of particulate pollution. Things like having less airways inflammation, lower systolic blood pressure, and improved short-term indicators of cardiovascular health. Okay, so there are only two published papers that have evaluated N95 use in children. The first is actually that same Dutch study I mentioned a minute ago with 11 children. They were using an FFP2, which is the European equivalent essentially of an N95 mask. They actually found a greater than 90% decrease in exposure for these children when wearing that mask. Again, though, this is that same research group that was assisting the children with putting it on and securing it tightly. And then the first published assessment of an N95 specifically designed for children was just published this last December. In that study, Go and colleagues were able to achieve an adequate fit, doing a true quantitative fit test on all 106 of the children that were tested. There's some manufacturers that have also reported proprietary data suggesting that many children could receive protection from a small adult respirator, particularly older children, and that when respirators are designed specifically for children, they've seen even further reductions. I definitely take that with a grain of salt, given that it's unpublished proprietary data, but I do think it points to the fact that these sorts of reductions could be possible were there regulatory standards for child respirators. I know there's been a lot of conflicting information about masks and respirators for the general public, so I wanted to just go over what some of these common concerns are. I know the first is that many people are concerned that encouraging the use of respiratory protection by the public, and specifically by children, may create a false sense of security and promote riskier behavioral choices. I think this really argues for clear communication so that people understand that their respiratory protection decreases their exposure, but isn't magical, right? Masks and respirators do not eliminate exposure. They're going to provide the best reduction when used correctly, and they really should be considered in the context of other preparedness options. So for wildfire smoke preparedness, for example, that includes having a plan for improvements in your indoor air quality. The second concern that's often raised is around safety of respirators for use in the general public. Most of the safety work has in fact been done in healthy adults. And generally what's found is that there are subjective changes. You've probably all had this experience recently wearing some sort of face covering. Often they make your face hot. It can be a little uncomfortable. Sometimes it makes folks anxious. But generally, the physiologic parameters, and these all come from N95 studies specifically, so not for other kinds of face coverings. Generally, physiologic parameters, things like heart rate, respiratory rate, blood pressure, change only slightly, if at all, and they usually have stayed within sort of normal ranges for healthy adults. That's also even been true even in small studies of healthcare workers wearing N95s for a really prolonged period, as well as a general population cohort of adults that included people with mild respiratory disease. That study of children that I mentioned before, the one that was just published last December, also did an assessment of children wearing the N95 versus not, both during reading and on a treadmill doing some exercise. That's the figure you're seeing on the right here. The blue or hollow circles are the children, the control children, and then in the red with the hash marks is when wearing an N95. So this is specifically showing the end-tidal CO2, which is the only thing that was found to be different in these children. End-tidal CO2 is sort of a marker of metabolic work. And you can see that there is a slight increase, but that the range overlaps, right? That there's a huge amount of variability within each of these categories, and that variability is much bigger than the actual difference between wearing an N95 or not. And for other measures, heart rate, respiratory rate, those did not change for these children. Lastly, the data on effects of respirators in pregnant people are mixed, but it is clear that there's no effect on fetal heart rate. So the data thus far suggests that respirator use is safe, both in the general public and in children. But while this literature continues to develop, I think the safest strategy is to use these for people who would be able to express if they were having a problem, right? It's expected that it might make your face hot and feel a little bit uncomfortable. But if you are able to tell that you're having difficulty breathing, you can take the respirator off. And on that note, as I'm talking about respirator use in children, I'm not talking about the youngest children, right? So for children under 2, or for whom masks could be a choking hazard, you want to be careful with those. You want to make sure that this is a child who could verbalize to tell you if they are having a problem. So just as the current CDC guidance recommends avoiding cloth masks in children under 2 or in people who are unable to remove the mask on their own, I think the same should hold true for respirators. We would only want to encourage the use of a respirator in a child who's capable of telling their adults if they're having difficulty with their breathing. So in summary, I argue that there is a benefit to the general public, including children, if they use respiratory protective devices, even in the absence of a respiratory protective program. I think it's important that we don't let the perfect be the enemy of the good here. We need to offer the public the protection that is available and be clear about what amount of protection is being provided so that they can make their own decisions.